Hello, my name is Jeremy with Faithful Guardian Training Center, and today we are going to be talking about shock. Specifically, we're going to be talking about types of shock that affect the heart. It's important to remember throughout this that shock is an inability of the body to be able to provide adequate cardiac output. And at the end of the day, that's what this is all about. So you have two main types of shock. You have cardiogenic shock, and then you have obstructive shock that are going to affect the heart. Cardiogenic shock, that is due to an internal problem with the heart itself. This means that there is an issue with the heart muscle or the way that the heart physically functions that is resulting in diminished cardiac output. The external causes, such as obstructive shock, that means you have something physically outside of the heart, outside of the physical function of the heart, that is actually contributing to the diminished cardiac output. That is the big difference that we're going to be talking about today. As far as internal causes, remember, it's a physical failure of the heart, and that is going to be cardiogenic shock. Cardiogenic shock is a physical failure of the heart. With that, you have two main types. You have a myocardial infarction, and then you also have congestive heart failure. Both of them are very serious, and both of them can and will kill you. With a myocardial infarction, you're typically going to present with chest pain, shortness of breath. Your patient may present with a gray or pale ashen color, and they can have cool and clammy skin as their body attempts to compensate for the body's inability to be able to provide that adequate cardiac output. The next type is going to be congestive heart failure, which we're typically going to see manifest in the case with shock is typically going to manifest as left-sided heart failure, which is going to result in pulmonary edema, which we're going to hear as rales or crackles in the lungs. And this just means that the left side of the heart, the left ventricle, isn't able to pump out as much blood as it should, which is resulting in blood backing up into the lungs, into the pulmonary vein, into the pulmonary capillaries, and blood actually gets pushed across the alveolar capillary membrane in the lungs, which causes blood to come out in the form of rales and crackles. Your congestive heart failure patients, again, they're going to have pulmonary edema. They can have jugular vein distension, as blood may be backing up through their vena cava, due to right-sided heart failure as well. They're going to have a low oxygen saturation. Typically, it's going to be in the 80s, maybe the 70s or 60s. And this is going to refer to their SpO2, or the amount of oxygen that is actually loaded onto the hemoglobin. In some cases, they're going to have an elevated respiratory rate, and this is them attempting to compensate. And they are going to be cyanotic due to hypoxia. And that is going to be the big difference between a myocardial infarction and congestive heart failure. Is your myocardial infarction, they may not be cyanotic due to hypoxia, because they may not be hypoxic, whereas your congestive heart failure patients, they are going to be hypoxic. Now, this does not mean that your myocardial infarction patient can not be hypoxic. It's just another sign to look for. Cyanosis means hypoxia. Pale, that means that there is diminished blood flow. Now, these are your internal causes of shock, or of cardiogenic shock. You have your myocardial infarction, you have your congestive heart failure. Now, getting into the external causes, this is going to be a cardiac tamponade or a tension pneumothorax. And again, your external causes, obstructive shock. These are going to be things that are physically obstructing the heart. It is a mechanical obstruction of the heart. Now, a cardiac tamponade occurs whenever you have fluid buildup in the pericardial sac, which surrounds the myocardium. And what this causes is every time your heart beats, it's actually getting obstructed by a fluid or a substance that's inside of your pericardial sac. Your trauma causes, those are actually going to cause bleeding within the sac tissue itself. And as you continue to bleed, the sac is going to fill with blood, which is going to leave your heart less and less room to be able to expand. A medical cause of of a cardiac tamponade would be somebody who has pericarditis, and as their infection and that inflammation causes pus to be secreted through the infected tissue, and you have this infected substance, it's actually going to get into the pericardial sac and cause that obstruction of your heart every time it beats. The worse the infection, the worse the obstruction of the heart's going to be. And the same thing is true of the trauma. Now, you're going to know that your patient is going to have a cardiac tamponade due to Beck's triad. Now, Beck's triad is clinical signs and symptoms that we see for these patients, and they consist of a narrowing pulse pressure, which means that your systolic and your diastolic are getting closer. You're going to have jugular vein distension as you have a mechanical obstruction of your heart. Your blood is not going to be able to enter the heart as effectively as it would, and we're going to see that with the jugular vein distension, which means that I have diminished cardiac preload. And so that's going to be reflected again by that jugular vein distension. And the next thing is going to be muffled heart tones. As you listen to your heart tones, you're going to notice that it's going to sound far away or sound dampened with your stethoscope. And this is just that final indicator, that third straw, to let you know that your patient is presenting with Beck's triad. And again, Beck's triad, narrowing pulse pressure, jugular vein distension, and muffled heart tones. And that narrowing pulse pressure, what that means is that is a narrowing, a closening of the gap between your systolic and your diastolic pressures. The next type of obstructive shock, again, which is a mechanical obstruction of the heart, is going to be a tension pneumothorax. Now, a tension pneumothorax, that is caused typically going to be air physically moving your lung tissue in the chest. Because you have air building up inside of the chest, outside of the lung tissue, outside of the pleural space, which continues to build up and build up and build up, and it's eventually going to create so much pressure that you can actually have tracheal deviation, which is going to be a sign of a tension pneumo. You're going to have absent lung sounds on the affected side. And the thing to remember about tracheal deviation is your trachea is going to point towards the good lung. Now, with these, you're also going to have JVD, which is a typical sign of cardiac tamponade as well. And you're going to have that JVD due to compressing of the vena cava due to the increased intrathoracic pressure. And your heart can physically get moved due to the pressure increase. Depends on if it's on the right side or the left side. And so this can mimic muffled heart tones. And it's not necessarily that the heart's getting muffled per se, it's just that the heart is physically getting moved, and where you're listening may not be actually where the heart is. So it's going to be further away. So those absent lung sounds are going to be that key indicator, because the tension pneumo mimics two of the things that a cardiac tamponade has, which is going to be that JVD and the muffled heart tones. But a cardiac tamponade is not going to present with absent lung sounds or tracheal deviation. Now, the big thing to remember about all this is that everything is going to result in diminished cardiac output, which at the end of the day is going to decrease perfusion, which means that our body isn't getting the adequate nutrients and waste exchange that it needs. So we've talked about the pump failure. That's going to be due to internal causes or external causes. The internal causes are going to be cardiogenic shock, which are typically going to manifest by a myocardial infarction or congestive heart failure. And your external causes, that is a physical mechanical obstruction of the heart, which are typically going to be seen with a tension pneumothorax or cardiac tamponade. And remember, everything is going to result in a diminished cardiac output. And those are the big types of shock that are going to affect your heart.